this is definitely something that I could not touch on enough in the previous podcast that I did, and tying it together with something that you mentioned earlier, even the trip to the vet, right? How can we make it better? What tips would you have for that? Because recently I took my girlfriend's family's cat to the vet, and that was a bad experience, and not so much for us, but I knew he was just not comfortable. But I'm trying to think of how exactly we could have made the ride over there better for him.
Well, cats don't get out of the home as much as dogs, which is why a lot of cats have a lot harder time riding to the vet. So a couple things is having the cat feel like, for cats, they need to feel like they are carrying their own scent wherever they go. This is very important in cats and cat behavior and such. So keeping the carrier out in your home all the time, because cats rub up and freshen their scent on the home items every 3 days. And then not only having the carrier out, but like feeding them in the carrier, getting that cat used to just going in the carrier with nothing related to going to the vet, So this way they don't associate. See, right now when you bring the carrier out for the vet visit, they know, uh-oh, vet. And they're already stressing out, and it's hard to get them in because they remember that was a place that was full of barking dogs, or everybody was holding you down, or, and they just look at that carrier going, what are you? You don't smell like me. I haven't rubbed up on you. Yeah. So keeping the carrier out, feeding the cat, making games to run in and out of his carrier, closing him up for a minute. This helps with loading him up. There are pheromone products like the Feel Away that help the cat feel like they've been in there and they've marked it. Then when you get to the veterinarian, I think it's important too that we have the cats come in hungry. We can give the cats food reward during their exams, and about half the cats will take those if they're hungry for it. Now remember, cats are slower than dogs on eating things because a cat needs to kind of smell it and investigate it before they consume it. But baby food, real tuna, this is, like I say, junk food's okay when you're here for your exam because they're working hard. It is stressful no matter how happy they seem to be. It's still a little off-putting, because it's still maybe just the once a year, or they're coming because they're not feeling good. They are throwing up, or they are having an irritated skin. And I'm going to have to touch it. I am going to have to do something that is a bit uncomfortable. I cannot eliminate that. I can reduce it. I can now make afterward nice. So again, their last memory still is a good one, which helps them with coming in. But as I say to my clients, I am the wicked woman in white. I am the one who's going to feel it, and I'm the one who's maybe going to give that injection that's painful, and I can do everything I can to minimize it, which is better. Yet I have to acknowledge that I, as the veterinarian, really also have to make this positive bond with this patient. It's not just for the technicians to do. It's not just for at home to bring them in happy or the clients, and those are important things to do. But as a veterinarian, I must also be a part of this. Wait until my technician or assistant says, yes, now proceed with the exam. I've got them held in a way that they're comfortable and safe. Or stop what you're doing, like not taking the treat anymore. You're hitting the painful spot before I increase the pain where this animal may bite. And then staph injury is a significant problem, or near staph injury. Sometimes they're missed, right? But is a significant issue in veterinary medicine. And it's not because these animals are bad animals. It's just kind of, the setup and what we're doing. It's improving, and that's what, we're all after.
I think this talk that you just had right here, this is definitely not mainstream, and I would like to see it more in the discussion, and people should be like, oh yeah, I know that. I would like to have that type of reaction to this information that you spread right here.